Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be kicking off talking about drafting health IT technologies, kind of an NBA, NHL themed show. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. So I'm happy my BYU player went number 5 or number 8 in the draft. So, they were saying 25. So the fact he went 8, I'm happy. He didn't go to the Jazz, which made me sad. But anyway, you've been enjoying the NBA, NHL drafts?
Yeah, I mean, I enjoy more for the intrigue ahead of the picks, right? Like who's trading up, who's trading down, where people are going. I find that more exciting. But I mean, it is exciting, I'm sure, for the players that do get drafted. And
Or
yeah, I mean,
disappointing if they fall.
yeah, or disappointing if they fall. It is interesting to see all the analysis that happens ahead of and around it. So that I like that. I'm fascinated by the comments people make about after who gets selected and when the pick is in, when the NBA does that. So yeah, it's kind of
I'm
a fun
still
time to be in
mad that my
sports.
Jazz didn't get the first pick after being the worst team, and they should have had it and had the most balls in there, and they fell all the way to 5th. Like, that's not fair, but anyway, it is what it is.
Yes, I'm a little disappointed my Raptors did not trade their pick. I thought they would
Oh,
trade it and
really?
get something, but they picked 9th overall, and by all accounts, it seems like it's a interesting pick. So we'll see.
You never
We'll
know.
see.
That's the trouble.
Yes, but yeah, this is gonna be fun. It's we figured we'd riff on that on the both drafts happening really soon, and so I'm interested in this, John, from you. What healthcare AI solutions are you drafting?
I mean, it's kind of like the first pick of the NBA draft was no surprise at all. We all knew Cooper was going first, and he should. He's a good player. It makes sense. Well, you'll not be surprised at all that my first pick on the board for the AI solutions is the AI medical scribe. Although it's really evolving to more of an AI assistant, so I don't even know if we can call them scribes anymore. And many of the companies I imagine are banning the scribe term and saying, hey, we are an AI assistant that can do all sorts of things. And so, as I look at companies in that, who are some of my top draft picks that I would select in that way, the first one is probably like Nabla. I love that, they just raised $100 million and they said, hey, we are moving beyond that scribe. We want to be the AI assistant for the doctor. So whether that's scribing, which is one AI assistant, or whether that's RCM, or whether that's CDI, or whether that's clinical decision support, I think they're going to build a whole bunch of AI assistants. I won't be surprised if they do an AI assistant to respond to patients, or even one to collect information from the patient to inform the scribe, right? I mean, that's going to be a core thing that you need in every team. To use the NBA analogy, your team needs that AI assistant, and that's going to be good. Just to shout out one other, like IKS Health. I think they're taking a similar approach, although they came from kind of the RCM side of things. And then, of course, they have a whole bunch of other technologies on top, including a scribe. But they want to be that full spectrum technology AI platform solution for you across everything that you need. And the fact that they have the RCM background definitely gives them a different perspective than some of the other AI medical scribes.
Yeah, hey, hard to argue with you, John. The AI scribe would definitely be one of my first picks as well. Hard to argue in the sense of so much benefit, such a strong ROI. It's very clear from all the evidence that docs really appreciate this. It really does save them time. It's putting the joy back into practice. I've heard that quote a lot from people, not from people from companies, actual physicians. I'm hearing this thing. So, by all accounts, it is doing exactly what it's advertising to do. So definitely would be on my first pick as well. There's some other companies I would mention. I mean, there's Suno AI, right? From our friends over at eClinicalWorks. They have some pretty good tools. Obviously, very much integrated with the practice side of medicine. I would also look at Suki and Abridge, of course, big players in the space. They have some pretty interesting tools. Up here in Canada, I have to highlight a company called Tally AI. Full disclosure, I do work with them through the nonprofit incubator up here that I'm affiliated with. But I think Tally AI has got some very good solutions for the Canadian businesses. So yeah, and you're right that they're morphing more into becoming AI assistants, and I think that'll just make them even more powerful, right? Like and even more valuable. So definitely a first pick draft for me as well.
Yeah, the real question is, did you just draft a bunch of big men, and then Epic's gonna step in there and just launch the three ball, and now the big men's aren't useful anymore, right? Yeah, so we'll see how that plays out for EHR vendors if they decide to go in and build their own, or are they going to stay with the partnership model? Check out our last episode if you want more info on that. But we'll see. Abridge has 300 million reasons of funding lately than their latest round to like what they're doing. Obviously, they're doing some good work as well. They have a good team. The other one I would look, and this would be a later round pick for me, as I look at, hey, how am I filling out what I'm doing? But to me, it's the AI platform. I love what Mayo Clinic platform is doing with all of the data from Mayo Clinic, along with the validation of the clinical, perspective on the AI tools. I think they're helping to accelerate kind of the evaluation and discovery of really interesting AI tools. So I love that. ADOC, who you're very familiar with as well, providing that platform to be able to do really interesting things, in the radiology space. Ramsoft has doing it, allowing the AI tools to be built on top of their platform is really interesting, and a way to get the radiologists access to the AI platforms. And then here's one that we don't hear about as much as we should in healthcare, and that's UiPath. They're doing automation. They started with RPA, doing the robotic process automation across every industry, by the way. But now, they're doing a ton in healthcare with RCM, with some of the operational things. And I'm seeing UiPath be used by a lot of even consulting companies to then leverage a UiPath to be able to solve some of the administrative challenges of healthcare. So having a platform like UiPath that could do almost anything allows a CIO to be able to say yes to requests that before they would have said, no, I don't think we could do that. That's not a priority.
That's a good choice, John. I'm gonna go a little different for my second first round pick because
Okay.
I have two first round picks.
Oh, okay.
Um, and
I
and
only had
to
a
to
one and a
use
second. You traded
to
up,
to
huh?
to use an NHL analogy, I'm gonna go very different and draft a goalie very early, which is very rare to do.
Really?
I'm actually gonna say that I think adding AI for RCM is very important because, as we know, revenues and finances are very critical. And I think for the next few years, we're going to be dealing with a lot of headwinds in that area in healthcare. So the more you can do to streamline collections, streamline getting reimbursed correctly without having to do rounds and rounds of claim rejection, I think AI for RCM can really, really help here. So companies in this space, Inovalon, AGS Health, Chitu, these companies that are doing some very interesting and cool things in the RCM world, adding AI assistance, if you will, for the RCM space. So more behind the scenes, less I think will really be valuable and a really valuable pick.
Yeah. Well, it's funny you say that. So, I mean, if we were to move to like healthcare technology first round, not so much AI, which is funny. I didn't actually classify the RCM as AI, and maybe I should have. They're definitely in my first round pick. I mean, and what's interesting is that like Smarter Technologies combined three companies, including RCM AI. Access Healthcare is their previous RCM company. That's really interesting to watch. Like, I love, if you will, the combo guard, right? Like that can do defense, that can shoot the three, that can drive the lane, right? Smarter Technologies kind of did that by combining three companies and saying, hey, we're going to do a whole slew of things well for an organization. Avelity is incredible. What they're doing on prior auth, be sure to check that out. Like they're already doing what the prior auth, insurance companies just said they would do. Like, hey, we're going to start doing e-prior auth. And Avelity's like, we're already ready to do that. Like, we don't have to wait till 2027. So I love what they're doing in the network that they have, the way they're approaching security. They have a lot of great assets there that, definitely make them draftable. And then, FinThrive, I think, is just super interesting because of the breadth of what they have, right? They're what do they call it? A five-tool player, right? That you could do all sorts of things for you. So, not to take the analogy too far. So I think that, that's in my first round of technology draft picks. It's funny, I didn't think of them as AI. I don't know if that's, what that says, or maybe every technology is AI. I don't know.
But that's good. I mean, and just in general, technology that I would put in my first rounds, for me, it would definitely have to be digital front door technologies. Again, I think we're just going to be struggling with getting patients to come in, partly because the economy is sort of waffling a little bit. So people are losing insurance, that people don't have coverage. So getting people to come in to get care is going to become more challenging, I think, in the future. So the more you can make it easy, the more you can make it easy to find a doc, to match to a doctor, to actually book an appointment. All the front door type things, I would say, would be part of my technology first pick. And companies in this space, Kairos, Hyro, Phreesia, like all of these types of companies that provide elements of these solutions, I think would be important ones to bring into a practice or to a hospital, just to make sure that you're getting the patients in when they're at the point of, okay, I need care, right? Like you want to make sure you capture it. And you could easily, without these technologies, make it too difficult and they'll go somewhere else.
Mm. That's interesting. In my first round, I'd also add, an archiving legacy app technology. Right now, the way the healthcare market is there's a lot of uncertainty. There's cuts coming to Medicaid that's, funding that previously funded so many budgets. And so no healthcare organization is really taking on outside of AI new technology. Instead, what they're saying is, how can you save me costs? And one of the clearest ROIs you can find is these archiving ones where you can get rid of legacy applications. I was talking with ClearSense CEO recently at HFMA, and he talked about these kind of dormant apps that are sitting there that nobody wants to cut because you've had them there forever, but they're actually not doing much. But actually what they are doing is they're providing a security hole for someone to breach your system, right? So, one, you can get rid of the licensing costs. Two, you can improve your security. Three, you can get access to all that data from the legacy system by putting it in some sort of archive. And so, whether it's ClearSense or MetaQuant, Harmony Healthcare IT does a ton in this. It's just a beautiful ROI that aligns with the current situation and current like market dynamics of a healthcare organization. So, having one of those is just so valuable. And those that don't do it, to me, it's like they're passing the buck. They don't want to admit that they acquired too many apps. And hey, maybe you need to bring a new GM in that says, hey, all of these players that we acquired, they're not who we need, right? We got to cut some of them. So I think that having that archiving legacy app, that's in my first round for sure.
You're definitely taking this analogy far, and I love it. I love it. I love
Just
it.
works out sometimes.
I mean, it's very clear how much you and I watch sports media.
It might be a sign of a problem. Yes, you're
It
right.
might be. It might be. Hey, listen, if you're tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. And today we are drafting health IT technologies and having a lot of fun with the analogy. So So John, okay, we dealt with the early rounds now. We got the big picks are off the board. We're now getting into frankly, the more interesting parts of the draft, the later rounds where we could really uncover some hidden gems in here. So what is one of your later round health technology picks?
Yeah, so in the later round, you want to take something that, sometimes you take a tried and true kind of role player, right? But sometimes you take a little flyer. And to me, the flyer in the later round is robotics stuff. So, if you're looking at it, there's this really interesting company about to interview called Diligent Robotics. And it turns out when they started doing it, they had one idea and then they pivoted and realized, wait, the real problem we need to solve with robots in the hospital is around transport. It's all your staff spending a half hour walking across the hospital just to go get a supply or to go get some medications or whatever it might be. And so they're applying robotics to that problem. And I think that's really interesting. I'm interested to see how the economics work around it. So yeah, I'm going to dive into that with them when I talk to them. But I think that's really interesting. And then in the home health space, I love what Intuition Robotics is doing with LEQ, and you know the ability to have always on access to someone at home, but also that it's proactively caring for the patient in some ways at home, caring for the senior, you know, the individual at home, and kind of providing a companion to them. I love what's happening there. And then another one, you know, that probably is already implemented, probably, you know, has already been drafted, but Omnicell, what they're doing with robotics in the pharmacy side of things, you know, the problem is a lot of people haven't drafted, you know, robotics in their pharmacy yet. So it's actually a tried and true technology. It did the 4 years of college, right? You know what to expect. But you know, a lot of people haven't drafted that yet. So, you know, to use the analogy too far. But I love what Omnicell is doing with robotics in pharmacy.
That's interesting. I like your analogy. I'm going with a pick that's I think more in the category of tried, true, trusted. Maybe it should be in the first round, but I would say any sort of cybersecurity solution needs to be a later round pick. We've definitely in healthcare got to invest more. We need to do more, and you know, because our threat surface is just increasing with the amount of IP-enabled devices and things in the hospitals now. There's just so many ways that things can go wrong. And let's be honest, social engineering from the nefarious players is getting better, right? It's not as easy to tell now some of the emails that you get and some of the things that you get, the downloads that you're supposed to do. And so I think investing in any sort of cybersecurity technology, whether that's from CrowdStrike, whether it's from any of the main players. I mean, I think that just is needed in the later rounds for sure.
Yeah. That's an industry one. You know, I don't know if, you know, again, taking the analogy too far, CrowdStrike has had a few incidents, you know, but you're betting on the fact that those aren't going to be a problem. And I think that's actually a pretty good bet, you know, like, in fact, when an incident happens, that's actually the best company to go to because they had to shore up everything that happened and, you know, and kind of realize it. And we see that in the draft, you know, in sports as well. You know, there's one area I like, which to me, it's a reliable thing that, you know, shouldn't be a later round draft pick. But I think we've kind of done that from a priorities perspective, and that's the smart hospital room. It turns out we've relied on whiteboards for far too long because they're just a cheap, easy solution, right? And so, like, we didn't, you know, want to replace it because it was like, hey, it works, like it's there. But I think it's time for, you know, the investment in, you know, the smart hospital room, you know, companies like Evidion. It's amazing how their technology really transforms the workflow, both for the patient, which is being informed with real-time updates and understanding integrated into the bed, et cetera, right? Like, I think that's all really interesting, you know, but also for the clinicians. The other one I would throw out later round is a communication one. You know, communication is so important. In fact, the problem is we drafted 5 of them and they don't integrate with each other. And we already have 5. So we probably need to cut 5 of them. And then we need to draft one that can do it all, right? So, you know, whether it's looking at the perfect serves, the Vocera together with Striker now, right? And the Carry Eye that they have involved as well, you know, Tiger Connect. But here's another case, you know, kind of similar to the AI Medical Scribe. Is Epic going to come in and kind of solve this with their hello world, with their secure messaging, with, you know, like, so I think that's the concern, right? You know, you may be drafting, you know, you may already have it in house and maybe that player just has been sitting on the bench. But yeah, for sure. Yeah, there's opportunity in the communications place, but you might have to cut 5 players when you draft the new one.
So are you saying that Epic's sort of like the Lakers or like the Yankees or someone? Like they're just going to come in and swoop in and just scoop up all the free agents and all all the big high
Well,
drafts?
I think it might be the person on the bench that, you know, you haven't ever played, and then you finally play them, and then you're like, oh crap, they can do this too. That's kind of what Epic does. It comes in and says, well, we haven't done this before, but you just never asked us, or maybe they just never had tried.
Well, I like your later round picks. In the communication space, I would add one more name, and that would be Artera. They are working on a platform. Their platform is trying to consolidate and make sure that all patient communications are, instead of sending 15 emails and texts to a patient in a single day, you're sending one or two, because it's a platform that can smart enough to combine all of the messages that you need to send to a patient and prioritize them. So I would definitely add that name to it. For me in the later round, I would add in some radiology technology here, because we know radiology is still one of the places where revenue generating, also very needed. It is the gateway to a lot of follow-on care. Right, you need this scan, you need those things to inform the patient journey. So here are some technologies all over the board, but anything around, like with Ramsofts is doing some really cool things in the radiology tech space. Philips, Canon, of course, but also companies like Scanslated that are using technology to make radiology reports easy for patients to understand, right? And so this goes back to the patient engagement kick that I'm on, obviously. Companies like Rad AI. I would also add patient education tools in my later
Hmm.
round pick, because that's another important thing. We need to increase healthcare literacy. So companies doing things here, Seamless MD is doing some fantastic things around surgery and surgical procedures and follow-on care. Centovia is doing some interesting things around patient education, along with Walters Kluwer's. So those would be my sort of technology picks for later rounds.
Yeah, you could have Pocket Health in there talking about the referrals. And I love how they're taking the radiology image and then tying it to the referral, which is the revenue that you talked about from radiology. So that's interesting. Yeah, I like that pick.
So last, John, I got to ask you this: are there conferences that you would draft? Are there any conferences that you're looking at, maybe in the fall, maybe even next year, that you're like, what, I should probably add that to my roster?
Well, I guess we're the Lakers. That's how I kind of am approaching it. I like the older players that are successful. So, I definitely am still hitting up the hymns, right? Especially if I'm, it depends on your organization. If you're looking enterprise IT, you need hymns for sure. The Lakers is a good analogy, right? Have LeBron, which is the hymns, but then they brought over from the Mavericks, a young player, a stud that can play really well, right? I mean, to me, that's Vive. Although has some backing, right? It's not like they're it's not a first round draft pick, right? He's definitely got some. It was more of a trade scenario for Vive, because they're paired with Chime, which has been around forever, right? So I like that, and I'll throw in health while we're talking about that, right? But I'd say that's more if you're looking for innovation, if you're looking for the cross industry perspective, including pharma, payers, that's where health is really thriving. And so, I think there's a lot there. But, there's a couple, to me, I'm really interested in the interoperability space. And you see so many health IT companies going to this interoperability space. And the discussions that happen there are a little more uh, calm and casual because it's not the frenetic nature of HIMSS and Vive and Health and all that. And so yeah, there's a ton of interoperability conferences. The Direct Trust conference is definitely interesting, and they're even doing cybersecurity and other things besides interoperability that is really powerful. Civitas obviously brings together some of the best interoperability people. And then you have to throw in the kind of three exchanges: eHealth Exchange, Sequoia Project, Commonwealth. They all do their own conferences, and so you get all of the interoperability people there. And really, it's like interoperability in action as they discuss, like, hey, what's happening and what are we doing and what do we need and how are the standards evolving, etc. I'm not sure ONC is even going to do their event. So I think we may rely on those, interoperability ones that I talked about more than ONC. We'll see. Maybe ASTP, ONC, whatever it becomes, will still do something, but I haven't seen, where that's headed.
Well, I mean, I would love to draft a conference that's set in Hawaii, or set somewhere like that. But
Look, I was gonna say cruise ship, but you don't like cruise ships, so
no, I'm not a cruise person. But there aren't that many. I guess the closest we get is Miami, or maybe over on the West
Ooh,
Coast in California. But
experience
no,
in
I mean,
Miami. You want to go there?
I mean, you're not wrong. I mean, there's definitely a lot of the stalwarts in our space that are would continue to be drafted high in my mind. Yes, the hymns, the vibes, the healths of the world definitely need to go to those. And then there's other big ones like RSNA and the one you just went to, HFMA. These are all, I'll call it the not granddaddies, but just they've been around. They're tried, they're true, they're trusted. You'd always give them the ball or the puck, right? Like that kind of thing. Um, but to your point, I think there are some interesting user conferences, that I'm finding those are really intriguing to attend. The Next Gen user group is phenomenal and really gives you good insight as to what really is happening in the practice space. The same with ECW's, eClinical Works user conference. Very interesting to get that really firsthand discussions with people who are on the front lines and kind of hearing what they're concerned about and what they're adopting. And I find that super fascinating, right? And we don't always get that at some of the larger IT focused conferences where everything is not so focused on the practice. Of course, I'm a little bit biased. You gotta go to the marketing ones, right? So you gotta go. HCIC is a good one in the fall, and we've had some. We just were at Neshco together. That's a great conference as well. HMPS, all of those, good conferences to go to. SHISHMED, um, and I'll throw in one flyer out there. I would really encourage us in healthcare to go outside of the healthcare round world for a couple conferences. Like maybe go to a cybersecurity one, maybe go to those types, just to get an idea of what other industries are doing. Because sometimes we get caught in our own little bubble.
Yeah, that's fair. I mean, just check out the user conferences, the Oracle Health. I think their new assistant's going to be there, and that should be interesting. Epic, they announced 100 AI things. What's the number going to be this year, right? Like, is it going to be 200, 300, or is it? Yeah, I don't know. It'll be interesting to see for sure.
Awesome. Hey, John, this was a lot of fun. So, and thanks to all of you who tuned in to this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page at healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.